pharmacogenomic phenotypes is the activities of individuals transporting metabolic enzymes activity. So obviously, the medications will be metabolized into less active metabolizers or the equivalent active metabolizers, and then the transporting enzyme will deliver the medications to various parts of the bodies. In Verapamil, for example, so it's actually a lipophilic medication. So in theory, it should have a higher concentration in the CNS, but because the PGP, which is transporting enzyme, transported it out of the CNS, so it actually doesn't have that much existence in the CNS system. So it is potential that if we have a less active PGP, this enzyme, then the presence of the verapamil in CNS would increase. And in a study before, it actually shows that when you use the PGP inhibitor, you got a higher concentration of verapamil in the CNS. However, this is the theory base. But that also shows us the potential that why it would affect the therapeutic response of the migraine patient. And also this also from the experience of antidepressants, because right now there is already established data to use the pharmacogenomic phenotypes to do the dose adjustment for antidepressants in the treatment of depression. And antidepressant is actually effective for some individuals in the treatment of migraine prevention as well. For example, like CYP2D6 is the FDA labeled actionable pharmacogenomic biomarker. Because we know that clinically in CYP2D6 ultra-rapid metabolizers, we need to do some dose increase for amitriptyline, venlafaxine, and nortriptyline. And then if it's a intermediate or poor metabolizer, we need to decrease the dose. So from the experience of antidepressant, it also tells us that's a promising that we will likely to find some associations and to be able to implement the pharmacogenomic phenotypes data to help predict a dose for migraine preventive medications for our patients in the future.